If you were brought up in a family household where you were constantly faulted, every single day, every single thing that you did was wrong. The way you sat in the living room was wrong. The way you chewed food was wrong. The way you laughed was wrong. The way you poured water into a cup or a glass was wrong. The way you drank that water was wrong. And you're constantly being told, why can't you be more like your sister? Why can't you be more like your brother? And this was happening to you between the ages of, let's say, 6 and 16. I would call those negative life experiences, adverse life experiences, bad life experiences. But a lot of people today would call them traumatic experiences. And I would quickly disagree with that because I think it's a very simplistic way of defining traumatic experiences. And the reason I'm saying that is because if I put 5 children of the same age group and expose them to the same set of circumstances where they were constantly corrected and criticized, there was unending disapproval and reprimand, I would have very different outcomes. In fact, out of the 5 children, none of them would experience these life experiences as traumatic. They might see them as unfair, unjust, but they won't get stuck there. Their life would continue. Like they would be able to put those bad experiences in their past and continue living in their present. But if there was one that is going to perceive these negative experiences as traumatic, there could be 1 or 2, at most 2. And so these 2 people or this one person who would perceive these negative life experiences, these unfair experiences in their household as traumatic, is less about what was being done to them, how they were being criticized, and more about the way that they perceived that criticism, the way that they interpreted that criticism, and the way that they internalized it. Meaning it's more about them than it is about the person who criticized. And here, it's very likely that they have an inclination to victim mentality, which is probably embedded in their personality type. Meaning the way that they're built is to perceive negative life experiences as traumatic, is to be victimized by the experiences that they go through and to get stuck in that victim mentality. And so for these 2 people or for this one person who would be affected, you'd find that the criticism will stop, they'll go to college, but they're still responding as if the criticism is ongoing. That's what trauma is. But the other 3 or the other 4 would be able to have moved on from that. But both of them were able to interpret the situation as unfair. One was able to come out of it on their own, the 3 or all the 5, and in some cases 1 or 2 would not be able to come out of it. They would get stuck there, stagnated in that period. So they go through life, they become leaders, they become CEOs, but the way that they respond to situations is as if there's criticism going on, but it isn't. And so the reason I say people calling these negative life experiences as traumatic is a simplistic view, and I disagree with it, is probably why a lot of people are now finding modern therapy very harmful, very toxic, very narcissistic. Because when these people with victim mentality come to therapy, the therapist validates their victim mentality, but not just that. They might not know it, but they also reinforce it. They keep this person stuck in the victim mentality. And so this person has to keep going back to them to get that validation, to get that reinforcement, to feel comfortable continuing being a victim. But then this person will say, I'm going to therapy, I'm doing the work. But people around them are not able to see the work because they keep hurting other people with their victim mentality. And that's what a lot of people are probably seeing and finding it difficult to be hopeful about therapy, to even try therapy, because they can see the harm. Life challenges, negative life experiences, adverse life experiences are life experiences, and they should remain that way. But if we start labeling all life experiences as traumatic, then we start diminishing, the importance of negative life experiences, where we're supposed to find our strength, to push our limits, to see how far we can go, and also to build resilience, to cultivate our resilience through these negative life experiences. So if we're going to mislabel them as traumatic, then all of us should be in therapy. All of us should be needing some sort of psychosocial support in our life, and that's just not true. That's actually an exception in the rule. The ideal in life is to be able to go through life without seeing a doctor, without needing any help from somebody. That's the ideal in life, is it? We want to be independent. We want to ask as very little of help from others as possible. And so that's the ideal. That's not the exception. The exception would be that you've reached a point in your life where you're not able to think properly, you're not able to think clearly, you're not able to think rationally. Then you want to come to me for support, but only in that period to sort of help you build a bridge to be able to restore your thoughts to be rational so that you can go back to living your life. You don't want to be constantly attached to me and keep coming to see me every day for the rest of your life. It's not helpful, because then it means you're not able to live life unaided. You need aid all the time, you need support all the time, you need help all the time. That should not be the norm, that should not be the ideal, that should be the exception.